Go ahead and start. Okay, we can go ahead and start. Yes? Okay, hello everybody. I think we're going to get started now. And they tell me the mic is not on, but is it on, Justin? All right, well, is it wireless?
This one, do you want to use it?
Well, I don't want to hold it, but
Yeah.
bring the stand over.
Oh,
Okay, so I think this may be plagued with technical difficulties, like throughout. So we're going to go ahead and get started. Can you hear me now? Good, good. Welcome, everyone. My name is Suzanne Gowdy. Some of you probably know that. Most of you do. And I have a couple of announcements. This session is sponsored by the Pastoral Ministry Associates, their mental health arm. And thank you, Kevin. I'm Kevin. Thank, thank you, Randy and Bridget, for being here to support me. Also, there are blue folders on that music stand, and in it I have information about NAMI DuPage, where I work. I also have evaluations that would be great if you could fill those out at the end. I think that's it for the announcements.
You might be candid out now.
No, just, you can, okay, thank you, Randy. Okay, so just to kind of know who's here, by show of hands, if you are comfortable, how many of you have a loved one who struggles with mental illness? Okay, a good amount, which is pretty much what I expected. And how many, if you're comfortable raising your hand, have had a loved one who has needed to be hospitalized or in some kind of a facility because they've had mental health issues? Okay, good. Not good, but I take that back. Not good, but talking about some things that, might be interesting to you. First thing I'm going to talk about is where I work at NAMI DuPage. Who here knows what NAMI is? Do you know what it stands for? Very good. National Association of Mental Illness. And it's the largest grassroots mental health organization in the country, maybe in the world. And it is, it's based, oh, do you know what it does? Because a lot of times I tell people what it does and they say, we don't know it did all those things. Does anybody know what NAMI does? Okay, well, I'm going to tell you. And it's actually a very unique place because everything that we do, whether it's education or support groups or one-on-ones, is done by the peer model. And the peer model is this. We have people that are trained by NAMI, but every person who volunteers or teaches or facilitates either has a mental illness themselves or has a loved one with mental illness. So that is what the peer model is, and we find it to be very effective. And actually, this is being used more and more in mental health facilities, too. So here's some of the things that we do. Under families, that's everything that I'm going to mention under families is what I do. It's under me, because I'm Director of Family Support Services, so we support the families. Family support group, and by the way, in the blue folders, I have a lot of this information. Family support group is a group for family members who have a loved one who struggles with mental health. And it's kind of unique because a lot of times when an individual has a mental health issue or crisis, excuse me, I need water, there's a lot of places for them to go. But when a family member is struggling with a loved one, they don't know where to go. They don't know where to get help. So NAMI provides that help for family members through education, support, and we'll talk more about that later. We have family-to-family classes, which again are for family members, and it's an 8-week class, and everything we do is free. And it gives a family member everything that they could possibly need to know about mental illness and how to support their loved one. We have a parent roundtable, which is a support group for parents of youth, And we have is kind of a unique leaders for this. It's a mother and her daughter who's 22, and she actually has struggled with mental health issues, and they're trained, and they really relate well to parents. And I'm kind of excited because next month we're starting a parent group in Spanish, because there's a lot of Spanish-speaking parents that are needing that kind of a group. We have a group called Hope After Overdose, and that is for people, family members who've lost a loved one to overdose. And often that's an accidental death. It's not necessarily a suicide, so it's kind of a unique grief. We also have a suicide loss support group for people who've lost a loved one to suicide. For individuals, we have Connection Support Group. It's like the family support group, only it's for people who have mental illness. And the family support group is facilitated by people who have a loved one with mental illness. Connections is facilitated by people who have mental illness themselves and are trained. And at NAMI DuPage, those two groups meet on the same night, every Wednesday at 7. And sometimes we have family members in family support and their loved one is in Connections, and they come together. So it's really great support. And we actually have someone here who's an intern at NAMI DuPage right now, and that is Keith DeVolt in back. And so congratulations to Keith. We also have a teen support group. And we have something called the living room. Does anybody know, and Keith, don't answer this, does anybody know what the living room is? Okay, well, the living room is something that we have at NAMI DuPage. It's open Monday through Friday, 2 to 8. And what it is, it's staffed by trained people who are peers, meaning they're highly trained to be there, but they have a mental health issue themselves. So if you're a person in a mental health crisis, going to an emergency room or a psychiatric hospital can be very scary sometimes. Sometimes it's like makes things worse. So to avoid that, you can drop in anytime to the living room and get help and support. And sometimes that's enough to help that person get through a crisis and not have to go to the hospital. And again, it's free and it's open Monday through Friday to drop in. And actually we're starting something new in about a month. We're gonna have living room hours for family members to come in and talk about their loved one. So that is some of the things. I didn't mention every single thing that NAMI DuPage does, but that's a few of the different things that they do. And there's more information about it in those blue folders. Okay. Okay, who is affected? Okay, how many U.S. adults experience mental illness each year? Anybody have an idea? Want to take a guess? You said 1 in 3. You said a lot. What is? Okay, let's see what it is. 1 in 5, 20%. How many U.S. adults experience severe mental illness each year? Any guesses? Okay, well, 1 in 20, which is about 14 million. And that 14 million are people who have, severe mental illness, not just like, they had a couple of bad weeks. How many U.S. youths aged 16 to 17 experience mental illness each year? Any guesses?
You mean 6 to 17?
What? Yes, age 6 to 17. Yes. Oh, and by the way, I am going to hopefully have time for questions at the end. But while I'm talking, if I say something and it doesn't make sense or you don't know what I'm talking about, you can go ahead and raise your hand. Okay, so that number is 1 in 6. What is the average age that mental illness begins? Let's see, 13, 15. 50% of mental illnesses start by age 14. 75% begin by age 24. So that is a time when you're going to see these things emerge. And it's because the brain is developing a lot at those points, and mental illness, especially severe mental illness, is something that usually develops pretty early. The average, go ahead, you have a question?
How are you defining mental illness?
Okay, so mental illness could be a mood disorder. It could be,
Like the DSM-4, 5?
yes, thank you. The DSM-5 is, for those who don't know, the Diagnostic and statistical manual that is used by psychologists, psychiatrists to help diagnose. Randy?
Like in these numbers of how frequently it's happening, how much has it changed in the last 20 years? Is it a lot? I mean, sometimes we think we're in an epidemic of mental.
Well, you know, there was definitely a bump up in mental health issues during the pandemic, and especially among youth, but among all people with the isolation, et cetera. But these numbers have been, other than that blip, pretty stable. And let me just read this last thing and then I'll get to you. The average delay between the onset of mental health symptoms and diagnosis is 11 years. So somebody's walking around for 11 years with symptoms and they're not getting help. So we'd like to do a lot better with that number. Somebody had their, yes. Okay, that's a very good question. So mental illness could be that you might go through a period of mild depression for some months and maybe you go see a counselor, you might take medication and you do better and kind of move past it. Severe mental illness is something like bipolar or schizophrenia or severe depressive disorder where it's not going to pass. You're probably going to struggle with these things throughout the rest of your life. Mary?
In my own experience, working for the patient and health department clinicians, that you mentioned schizophrenia, it's very common for that to manifest around age 19 to 21, which is usually when young people are in college.
Yes.
Because that also is connected to the brain development and also to the fact that that you can camouflage that for a long time and get by, and the symptoms don't get as severe until about that, around 20, 21.
Right. The brain is developing at that point, and certain mental health conditions are more prevalent at specific life stages. Anxiety and depression often develop during adolescence or early adulthood. Schizophrenia and bipolar, you just mentioned, manifest in late adolescence or early adulthood. And schizophrenia, by the way, is pretty rare. A lot of people think that their loved one has schizophrenia, but they don't, because many mental illnesses, including bipolar, anxiety, severe depression, can cause people to have psychosis. Does anybody know what psychosis is? You can say with that. Lose touch with reality, hallucinations. They sometimes feel that someone is talking to them in their head and they can talk back. Paranoia, or they think someone might be following them, or they might think that they're some great person. Basically, yeah, they're not in touch with reality. And that, the phenomenon of psychosis can manifest itself with many different mental health issues. And so some people think if someone has psychosis, they're schizophrenic. Mostly not the case, because schizophrenia is more rare. Yes?
There's been these weird statements from like the Canaan DA sheriffs that they want to keep people in jail longer so that they can give them mental health services. And I wonder if what the mental health community's reaction has been to that, and like kind of is that way, or would it be better to put it a different way, like outside of jail?
Well, we are going to talk a little bit about that a little bit later. I'll get to that. He wanted to know, he said apparently, did you say the DuPage County Sheriff made a statement that they wanted to keep people in jail longer so they could get mental health care? So we're going to talk about that a little bit later, not specific around that. Okay, back to my slide, risk factors. It's a complex interaction of several factors. And there's a lot we don't know, but it can include genetics, that's a big one, environmental stressors, trauma, substance abuse. And notice what I did not put up there, and that is your mom. So, so mental health and mental illness is not because of like bad parenting or your mother or your relationship with her. It's very complex, and there's so little that we even know at this point about the brain. We're just only learning, but there's definitely genetic things that they're finding more about all the time. And it is something in your brain that is not, to use a layman's term, wired correctly. having a mental illness is not a choice. It's not a weakness. It's not a character flaw. And it's often not something that just passes or can be snapped out of with willpower. And I think most of you know that, but I mention it because there's so much stigma against mental illness. And people just think, well, if that person just tried a little harder, you know, they would get through this. But there's more going on. It is a medical condition in your brain that often people do not have control of. So I wanted to bring that up. Can mental illness be cured? Can it be cured? There is no cure for mental illness, particularly very serious mental illness. And by the way, it can't be prevented. Just in the same way that, like, you know, your dentist is always, it starts as a kid trying to prevent tooth decay. And despite best efforts, many people still get cavities because it's the same with mental illness. You know, you can't prevent it. Sometimes you don't have any idea that it's going to happen. It's something in your brain. There is no silver bullet. A lot of family members think, well, if my loved one just took their medications regularly, you know, they'd be a lot better. Sometimes medications do help, but we're still in the early stages, really, of understanding how medications work on the brain. And sometimes they work. Other times, some people are resistant to medications. Their brain doesn't work for them. And so, and some people might be taking a certain medication that works, and then maybe 2 years later, now it doesn't work. It's very complicated. So while there's no silver bullet, really helping someone with mental illness takes a whole combination of things. It takes maybe medication, therapy, support from loved ones. All of these things contribute to that. The key is to manage the symptoms and to get help early. And that's why we'd like to do something about that gap of having symptoms and it taking 11 years on average for people to be diagnosed. Delaying treatment can make a condition worse and harder to treat. So it's really, really, really important. Don't diminish symptoms and or assume they'll eventually go away. Jan? Why is that? Because there's not great access to medical care. There is stigma, so sometimes their family members or themselves don't necessarily think they have a problem. There are just gaps in the system about people, you know, other people and themselves recognizing what the issue is and that they need help. Kathy? A teenager. Yeah. Yeah. Is there hope? Yes. With early and consistent treatment, people with serious mental illness can manage their symptoms, their condition. They can overcome challenges and lead meaningful, productive lives. And actually at NAMI, we see it all the time in the family support group. We have family members with loved ones who have had terrible mental illness, very severe, and we see them make progress and we see them, you know, do better. So is it something that goes away? No. It's a lifelong struggle, but people can lead good, fulfilling lives. And we're getting better at treatment and support all the time. Not fast enough, and I worry how that's going to go with this administration, but we're working on it. Mental illness is a social justice issue. And I feel like that's not something, I mean, I don't hear that talked about here at DUUC, and I don't really hear it talked about in UU in general. And I think it's wrong because mental health is a social justice. Mental health is a part of DEI. And there's many things, disability rights. There's discrimination and definitely in employment, education, housing, access to care. This is a problem for everyone, but especially in underserved areas. And in poorer areas, there is not enough clinicians, psychologists, psychiatrists, counselors. There's not even enough NAMIs in underserved areas. So that is definitely something we need to keep working on. Criminal justice involvement. Often, due to lack of resources and understanding in the criminal justice system, people who are mentally ill end up in jail when they shouldn't. There is mental health court, and in DuPage County they have mental health court, and it's better than a lot of places. It's actually one of the leading ones, but it still has a lot of flaws. But another thing that's happening that it can be really helpful is CIT training for police officers. Does anybody know what CIT training is? It stands for Crisis Intervention Training, and it's a training program for police officers so that they can understand and recognize and know how to respond to someone having a mental health crisis. And it'd be really important to have more of officers that understand that, to keep mentally ill people out of the criminal justice system. If the police go on a call and they recognize this is mental illness, they don't need to arrest them and put them in jail. Suicide prevention. Suicide prevention is partly, we could be doing a better job partly because of stigma. Again, lack of access to care. We talked about that 11 years. If people could get care earlier, it might not come to suicide. And there's just major barriers for people getting care. And if we could have better care quicker, it could be more effective. Dismantling systemic barriers. Again, addressing the inequalities and promoting equity in areas like education, healthcare, housing. It's crucial to improving mental health outcomes. You know, again, if you don't have good housing, it's going to be real difficult to work on your mental health issues. If you're not educated, again, it's going to be harder to get support, to get a job, to have understanding about what's happening to you. And again, access to healthcare is so important. And so this is, you know, this is a social justice issue that I'd like to see our church think about a little bit more. Combating stigma and discrimination. We all have stigma. Even I have stigma and I work at NAMI because it's just ingrained in us. We grow up with this. We all have stereotypes about what mental illness is and what someone with mental illness is like. But you know, like when someone in your family, let's say, has heart surgery, everyone calls, everyone helps, they bring meals, they say, what can we do? But what happens when someone in your family has a mental health crisis? Yeah, it's crickets. And some people in NAMI call mental illness the non-casserole illness, because when someone's having a crisis, no one brings the casseroles. And this is because of stigma. People are very uncomfortable about mental illness. People don't want to acknowledge that it's a thing. And we are kind of working on it, but we have a long way to go.
Suzanne?
Yes.
But isn't one thing that we just really don't know what to do?
Yes, and that is true. Sometimes I have found in my own family or friends circle that people care, but they're extremely uncomfortable about it. They don't know how to approach it. They're afraid. There's a lot of fear around it. And so I would just encourage people, if you know someone who is struggling or a family member that has a loved one struggling, you can just say like you would if their loved one was sick, like, how's it going? Is there anything I can do? Do you want to get coffee? That's all, and the person will share what they want, but it's important for that person to know that you care. And also, social justice is an intersectional issue. Mental health intersects with other kinds of social justice issues like racism, LGBTQ. What are some other areas that mental illness intersects with as social justice issues? Yes, yes, that is very true. She said immigration status. Yeah. And sometimes people might be afraid to get care because they're afraid to go to a doctor because someone might report them. Carol? Yes. Because actually elderly people do have mental illness. Sometimes it can get worse when they're older and isolated and their brain is not functioning as well. Yeah, homelessness is a big one. So many people that are homeless have mental illnesses as well. And there is some supported housing out there for people with mental illness, but it's really hard for homeless people to even find access to that. So again, mental illness is a social justice issue, and I really think we need to focus on it more because of all the groups that we can think of when we think of social justice issues, people with mental illness are in that. Okay. So this is, oh, go ahead.
Going back to that, what about like employers and insurance companies?
What's your question specifically?
Social action, because there may be part of the access to it.
Yeah, insurance is supposed to have something called parity with medical and mental illness, which means that they have to provide the same coverage at the same level for your heart as well as your mental illness, and they still don't, even though it's a law. So that is a huge issue. Okay, this is one person in a crisis. And when that one person is having a mental health crisis, studies show that there can be anywhere from 5 to 10 people behind them that is also in a crisis now. You know, when your loved one that lives with you is having a mental health crisis, so are you. And so we now know, you know, that there's 14 million Americans with severe mental illness. So if you multiply that by 5 loved ones, you have on any given day 70 million Americans that are in a crisis. So that's why what we do at NAMI is so important to support the family members. And there's a lot of impacts on family caregivers for people who have mental health situation. There's exhaustion, lack of sleep, worry, stress, not unlike if you were caring for an elderly person who has dementia or, you know, a child who had chronic illnesses. It's all of the same things. Often, though, you have feelings of guilt, you have shame, you have grief. And if you're a caregiver of someone that's in a mental health crisis, you can also develop some mental health issues from doing that. And sometimes there is fear for and sometimes of their loved one, because sometimes depending on what type of mental illness a person has, their behavior can be very volatile, and it can be scary sometimes. Yeah. Yeah, yes, and we're going to talk about that a little more about safety issues further in. Okay, she was saying that she has a loved one that she lives with who has mental illness, and sometimes they're volatile, and sometimes she's been afraid. Did I say that right? Yeah. And we're going to talk a little bit about that later, about what we can do about that. Okay, challenges faced by families. Often no communication with the mental health care providers of their loved ones because, you know, we have HIPAA laws about privacy. And so if your loved one doesn't say the doctor can talk to you, then they can't. It would be more helpful if doctors, you know, encourage their loved ones to share with their families what's going on, because the partnership of the person who's struggling with the family, you know, can make the outcomes much better. And there's obviously lack of resources and knowledge, stigma, isolation, all those things that we talked about. And 50% of families say that when a loved one is discharged from a hospital, they're discharged before they are ready to come home. And so if you're the caregiver, now this person who's mentally ill is not ready and they're coming home and now you're going to be the caregiver, it's daunting and can be scary. Yes?
Yeah, and sometimes that release is because insurance.
Yes, it is. Well, a couple things. Insurance is definitely a factor, but also it is not against the law to be mentally ill, and so a facility cannot hold you beyond a certain point if you're not a danger to yourself or others. So, I mean, that's good in a way, but then it's bad in other ways. What does research tell us? When families participate in care, the outcomes are better for people with mental illness. So it's really important for families to get support and education because it improves the lives of their loved ones who are mentally ill, including, and again, they've done studies on this, we have evidence, reduced hospitalization, reduced relapse rates, and increased recovery. Okay, tools for success. If you're a family member supporting someone who has mental illness, what tools do you need? Boundaries, communication skills, and de-escalation. And we're going to talk about all these more in detail. Your goal is not to fix your loved one, but actually to improve your relationship with your loved one who is struggling. Okay, now, before I talk about some of those in detail, I have a video. One of the things that you're going to need if you're going to do these things with your family member, you're going to need empathy. And I have a video that really does a great job of explaining empathy. It's by a woman named Brene Brown. There's a problem. YouTube now has ads on here, and we couldn't get rid of it. So for a few seconds here, there's going to be an ad, and we'll just let that run. And don't pay attention to the men in the kitchen. They'll be going away soon, and we'll be watching the video about empathy. Right, Justin? Okay, I think it's coming. Hopefully. There we go.
So what is empathy, and why is it very different than sympathy? Empathy fuels connection. Sympathy drives disconnection. Empathy, it's very interesting. Teresa Wiseman is a nursing scholar who studied professions, very diverse professions where empathy is relevant, and came up with 4 qualities of empathy. Perspective taking, the ability to take the perspective of another person or recognize their perspective as their truth. Staying out of judgment, not easy when you enjoy it as much as most of us do. Recognizing emotion in other people and then communicating that. Empathy is feeling with people. And to me, I always think of empathy as this kind of sacred space when someone's kind of in a deep hole and they shout out from the bottom and they say, I'm stuck, it's dark, I'm overwhelmed. And then we look and we say, hey, climb down. I know what it's like down here, and you're not alone. Sympathy is, ooh, it's bad, no, you want a sandwich? Empathy is a choice, and it's a vulnerable choice, because in order to connect with you, I have to connect with something in myself that knows that feeling. Rarely, if ever, does an empathic response begin with at least. Yeah. And we do it all the time. Because you know what? Someone just shared something with us that's incredibly painful, and we're trying to silver lining it. I don't think that's a verb, but I'm using it as one. We're trying to put the silver lining around it. So, I had a miscarriage. Oh, at least you know you can get pregnant. I think my marriage is falling apart. At least you have a marriage. John's getting kicked out of school. At least Sarah is an A student. But one of the things we do sometimes in the face of very difficult conversations is we try to make things better. If I share something with you that's very difficult, I'd rather you say, I don't even know what to say right now, I'm just so glad you told me. Because the truth is, rarely can a response make something better. What makes something better is connection.
Okay, so now we're going to talk about some of those tools. Communication. Remember, I said earlier, the key is not to fix your loved one, but to build and strengthen your relationship with that person. And so communication is a big one. It's really essential when you're supporting a loved one with mental health struggles because it fosters understanding, trust, and a stronger relationship. Again, we can't fix our loved ones. We can only support them on that journey. And so in order to really be a good support, you need to work on that relationship. So good communication builds trust. It encourages understanding. Don't assume you know or understand what your loved one feels or how they're experiencing something. Be curious. You know, someone who's having a mental health crisis might say something that to you, you don't understand it or it doesn't make sense. But to them, it does. So ask them about it. How is that for you? Validate their feelings and instead of trying to convince them that they don't feel as bad as they say they feel or trying to fix it, validate it. And let me just give you an example from my own life of how that could work. My daughter, she has struggled, and sometimes she might say, well, like there's a party Saturday, but I'm not going to go because nobody likes me, I'm not interesting, I never have anything to say. And as a mom, I would always want to swoop in and say, oh my gosh, like people really like you and you're so interesting. But that didn't help her. That's not what she needed. What she really needed me to say was, wow, I'm really sorry that you're feeling that way. That sounds really hard. Let me know if I can help. And leave it at that. And when I did that, then she knew that I heard her and I understood how she was feeling, because I couldn't fix it that she felt that way. As much as I wanted to fix it, I couldn't. But by really listening and acknowledging how she felt, it did build up a better trust between us. And I think, we've worked on this for years, but I think she sees me and Kathy, her stepmom, as more of an ally. As before, it was just, she was just bumping up against us. We didn't get her. And so it's really important, this actually is important for everyone in your life to do this, by the way, not just people with mental illness. But if you have mental illness, it really helps when those that are supporting you validate how you feel, because maybe you don't understand it, but it's how they feel. And building a relationship is what support is. It's not, again, you can't fix them. How can you? But you can support them. And it strengthens the relationship. And good communication normalizes mental health conversations. Checking in regularly, like, how are you feeling today, makes mental health a natural part of the relationship. And again, part of the stigma, we don't want to talk about it, but as you build a relationship with your loved one, it should be just normal. Like if someone had diabetes, and you love them, you might say, how's that going? This could be similar. Now, obviously, don't ask them something that's going to make them feel defensive or they don't want to talk about it, but in building that relationship, acknowledge that this is going on and it is, and you want to know if there's anything you can do. Use I statements. What's an example of an I statement? Does anybody have an idea?
Say like, I feel, or is it like that? I'm thinking about the I feel statements.
Yeah, instead of saying,
Do this, I feel this way.
yeah,
When you behave like this.
correct. Instead of saying, you never listen, Sarah. Sarah, I feel like you're just not giving me a chance to talk right now, and I really need to. So I'm not like accusing you of something. I'm saying how I feel. And that is really important to do that with someone who has mental illness. Don't come after them. You're not doing this. You said you would do this. Just say, I've noticed you seem to be struggling. And again, this works with all of our loved ones, even if they're not having a mental health crisis. So. Foster calm conversations. When you use I statements, it's more calming, because if you're saying you're not doing this, you're escalating things. You want to avoid accusations. And it also, using I statements, encourages problem solving. It shifts the conversation to finding solutions instead of arguing. Okay, let's talk about boundaries a little bit. And I know I went through that fast. And also I wanted to say about communication. We're not born knowing how to communicate great with people. It is a skill and it can be learned. And those are just a few of the things that you would do. And I can't, give you a whole tutorial today on how to do it, but it's something to start to think about. And if you want to know more, you could attend some NAMI support groups, for example. Healthy boundaries, boundary setting is an essential part of supporting a loved one who struggles with mental health. So what are boundaries? Anybody like?
For example, rules of behavior,
Yeah, it's not exactly rules of behavior, but you're on the right track. It's more, what is okay with me? Where's my boundary page? And why do we need them? So boundaries are not like set for your loved one who struggles with mental illness. Boundaries are for you. It's saying, this is what is okay with me. And it helps to preserve your own mental and emotional well-being. Because if you're not doing well, if you're, being too taxed and stressed by supporting this person, you're not going to do them any good. So boundaries are for you to say, this is what I'm willing to do and this is what I'm not willing to do. It encourages personal responsibility. Like, you as a caregiver need to take personal responsibility for yourself and what is good for you. It prevents enabling. What is enabling? Jan. That's one way. What else? Carol. Yes, enabling is doing for someone what they could do for themselves. And this is very hard for family members, especially adult parents who have, adult parents, of course they're adults, parents who have adult children. This child of theirs might be 40, and they're still doing a lot of things for that person that they could be doing for themselves. And you're kind of depriving them of that, and you're depriving them of having the chance to take on some challenges that they can maybe do. And when you're setting boundaries, it models healthy behavior. Benefits for you, it promotes better communication with your loved one because you're letting them know, instead of not telling them what your boundary is and then it's crossed and now you're angry, let them know ahead of time so that it is, out in the open and you don't have to get a confrontation later because they already know. It means your needs are met, and that is extremely important as a caregiver to have your needs met as well. Less anger and resentment, like I talked about, and less conflict in relationships. If everyone kind of knows what people's boundaries or limits are ahead of time, you can avoid confrontations later because you've already talked about it. And again, this works with everyone in your life. And it's important to feel respected by yourself and others. And definitely less anxiety and stress. Benefits for others. When you set the healthy boundaries, you are helping your loved one who has a mental illness. You're teaching them some self-reliance. Like, I'm not going to pay for your internet anymore. You're going to have to use the money that you have to do that. So they're going to be like, okay, I have to figure that out. You're teaching them respect for others. And independence. Again, it goes back to that enabling. People who have mental illness, sometimes they are limited in what they are able to do. But I think well-meaning people sometimes do a lot of things for them that they should be doing for themselves. So think of it as like depriving them of having an opportunity to have their own independence when you do it for them. And it's really hard because when you love someone, you want to help them, but sometimes we help too much. Okay, let's talk about de-escalation a little bit because people with mental health issues, sometimes their emotions and their self-control is not easy for them to always have. And so you have to be careful in that. De-escalation, what do you think it means? I know I put the definition up, but there's other ones.
Not to be reactive yourself.
Yeah. Staying calm, don't be reactive, because it's going to make it worse. And why de-escalation matters? Definitely reduces conflict, improves communication, keeps everyone safe. And when everyone is calm, it's easier to work through problems. And sometimes you might have a loved one that you lived with who has a mental illness, and there's something bothering you and you're wanting to talk to them about it. It's really important to wait until that person is kind of having a good day and calm, and then, choose that time like, well, they're having a good day now, I'm going to talk to them about this thing that might be a little difficult. And so you're not de-escalating, but you're setting it up so that you don't have to de-escalate. How to de-escalate? Stay calm, which is really hard to do when someone is in a crisis themselves, or they're saying something that's making you angry or agitated. But it's really important to try to stay calm. And I say that and people are like, well, that's hard to do, but It's something you can practice. Using the I statements again is a great way to de-escalate. Take a break. If you are, having an issue with someone with mental illness and you're getting really frustrated or you're getting worked up yourself and you can't seem to calm down, it's okay to say, you know what, I can't talk right now, I need to take a walk, or I'm just going for a drive. It's remove yourself from the situation. And sometimes that helps the other person get in control when you actually leave the situation. Okay, how to keep everyone safe in a crisis. Stay calm. Listen to your loved one without interrupting or judging. Again, back to that empathy. Show empathy and listen, even if what they're saying doesn't make sense or it's hard. Validate their feelings. We talked about that before. Don't dismiss or minimize their feelings, even if what they're saying doesn't make sense to you, because for them, that's how they feel. It's real. Reassure them. Remind them that they're not alone. It's okay to say, I don't really know how to help you right now, but I'm here. Let me know if you need anything. Reassure them. It makes a difference. Avoid confrontation and offer distraction. You might suggest a calm activity like going for a walk, or maybe they're thirsty, maybe they need some water. Sometimes distracting someone when they're starting to escalate can help to keep the temperature a little bit lower. Okay, now this last one, seek professional help, call 911. Number one is safety for everyone. And I know you had mentioned back there about you have a loved one that could get volatile and it can be scary. And so if anybody here has a loved one and they're afraid, absolutely you want to call for help. However, sometimes calling 911 can make things worse because they don't necessarily understand when you make that call that this is not a criminal situation, it's a mental health crisis. And so this is what I tell families to do, is if you have a loved one that lives with you who has a mental illness, and they're okay now, but you know that maybe they could be volatile, I recommend calling the non-emergency number of your local police department. And Naperville does have CIT trained officers, they have social workers. And if you just call the dispatch non-emergency, when you're not in an emergency, you can say, here's where I live, my loved one lives with me, here's symptoms they have, and I just want to let you know what's going on with them. They will take that report down and they keep it. And so then if you do need to call them someday because you're not feeling safe, now they know, okay, this is a mental health issue. And they won't come with sirens and guns. Sometimes they can bring a social worker. And that is really key. I recommend that to everyone to keep people safe, because sometimes the police don't always do the right thing either. Also, what was I going to say about that? Yes.
Where do you live in North Aurora, and we're in a unique position because if we call the non-emergency number during off hours, it is not supposed to North Aurora. It goes to Aurora, and they don't speak records.
Okay.
And we call the 911 in North Aurora where we live, then they wouldn't have the record.
No. You can go in person. You can go in when it's not an emergency and say, hey, I just want to give you some information about my loved one, and have them write it down. And so another thing I wanted to say, if you live in DuPage County, they also have, and if you live in DuPage County, this would be free to you, they have a mobile crisis center unit, and you can call them, and they will come out and do an assessment of your loved one if you think that this loved one's having a crisis. The loved one has to agree to let them in, but if they do, they do that. Jan? You mean for the police? Yes. They should know that. I mean, I know most of them are supposed to be keeping that record, and when you give the address, it should come up in their computer system, yes. But it's okay to say it again when you call. The more information is better. So yes, if you live in DuPage, we are fortunate that we have that mobile crisis unit, and they're very nice people that will come out. And some things that you can do if you have a loved one in a mental health crisis and you're very concerned. Things you can do other than going to the emergency room. DuPage County has a fantastic crisis center that you can take them to. It's open 24/7. It's actually in the same building where NAMI DuPage is, and it's over by the courthouse. And you can take them there, and the crisis center, it's a great place. They do not keep someone there against their will, but they give them resources that they need. So that is always an option. It's 24/7. It's in Wheaton. Again, there is the crisis mobile unit, and there's always the living room too, if you can, get them to go. But if you're not, again, number one is safety. So if you're not safe, definitely get help. But some things you can do ahead of time to make that help go better is really important. These are just some little things. Be patient and understanding. And these are all things that we talked about throughout the slideshow. Respect their boundaries. Be consistent. Offer support without pressure. Don't say like, you need to get help and why aren't you calling your therapist? Just say, hey, I know you're struggling. Let me know if I can help. Do you need me to help you? Call a doctor. Educate yourself as much as you can. Encourage your loved one to get help. They don't always want to, but you can encourage them. Model the healthy communication. Celebrate the small victories. And celebrate small victories is a really big one. It's so important because a person struggling with mental illness is on their own timeline, not ours. You wouldn't rush someone's recovery who has cancer or heart disease. It's the same thing with mental illness. And when you notice small changes in your loved one, you'll begin to see and appreciate the journey that your loved one is on. And I can take some more questions at the end, but I do have one little thing that I'd like to read. And it's written by Ernest Hemingway. A note from our loved one is what I titled it. That's not the actual title. But this is, imagine this as your loved one talking to you about how they feel. In our darkest moments, we don't need solutions or advice. What we yearn for is simply human connection, a quiet presence, a gentle touch. These small gestures are the anchors that hold us steady when life feels like too much. Please don't try to fix me. Don't take on my pain or push away my shadows. Just sit beside me as I work through my own inner storms. Be the steady hand I can reach for as I find my way. My pain is mine to carry. My battle's mine to face. But your presence reminds me I'm not alone in this vast, sometimes frightening world. It's a quiet reminder that I am worthy of love, even when I feel broken. So in those dark hours, when I lose my way, will you just be here? Not as a rescuer, but as a companion. Hold my hand until the dawn arrives, helping me remember my strength. Your silent support is the most precious gift you can give. It's a love that helps me remember who I am, even when I forget. Any more questions? We still have about 3 minutes. If you have any other questions or thoughts, yes.
Statement. In addition to now, there are other programs that are free or low cost, like 12-step groups, for the family member, not necessarily the person with the condition, but the family member with the condition. And I personally found that very helpful.
Yep, 12-step programs can be very helpful for people with substance abuse. Russ?
When our daughter was in high school, we were very active in the high school with music boosters, and we knew a lot of parents of our kids. We have 2 kids in high school back in Massachusetts. When our daughter had a mental health crisis, everybody disappeared, but one couple who had a son who had a mental health issue.
Which came later.
It did.
Yes.
Okay, but she was empathetic. She was our only friend for a while.
Yeah.
I find that very interesting. I don't know if you find other people who have mental health issues in their family, but it was a lifesaver.
Yeah, and it's
That one
interesting
family.
because when I first came in, I said, who here has a loved one with mental illness? And like the majority of the people raised their hand. but it can be lonely. And, you know, in our family support groups, we, you know, have people saying, it's so good to be able to talk and have people that understand and get it, because it's just really hard. Any other comments or questions? Yes, Robert.
People, LGBTQ folks often get a lot of great support from organizations like Youth Outlook.
Yes, yes, very great organization. NAMI also has an LGBTQ support group as well.
Remind people that this is being recorded, so if they want to share with others, so they can watch your great
Okay.
presentation.
Randy says to remind you that this is being recorded if you'd like to share it with others. Bridget.
Does NAMI provide referrals to people who are looking for counselors or psychiatrists, or do they have resources to some? I feel
We
like
do
that's
have some,
something
yes.
people are often looking
Mhm.
for, is a way to find a therapist or a professional that can help them.
We do have resources. It's very hard to find someone, but we, you know, we can try to steer people in that direction. You know, I can't personally like recommend a practice, but I can tell you, I can steer you in the right direction to find it.
So
Yes.
NAMI is a place that we
They,
can refer
yes,
people to if
it
they're
would,
looking for something.
absolutely. Yes. Any other questions, comments?
You made a comment about being fearful about what might happen politically. Can you
Yeah.
give it some sense of?
Well, many people that have mental illness are on Medicaid, and you know that they're trying to cut that. And I really worry, because a lot of the people who come to NAMI with mental illness are on Medicaid, and it's their lifeline, so I'm worried about that. Robert, did you have something?
I just want to put in a plug too for our child circles, the men's group, people going through life transitions, the death of a spouse, or all kinds of life transitions, often get a lot of support from those small group
Yeah,
experiences.
yeah, it's really important. Anything else? So I think we can wrap it up then if you don't have any other questions. Remember to fill out an evaluation, and there's blue folders there that I put with information about NAMI and so a few handouts about some of the concepts I talked about today. Thank you for coming, and thanks to Pastoral Ministry Associates for putting this on.